Welcome to the American Medical Association walkthrough on the new merged pathology laboratory CPT code application. My name is Leanne Stancic, and I am a Senior Healthcare Coding Analyst with the American Medical Association. The purpose of this walkthrough is to highlight the changes from the old molecular pathology and standard pathology laboratory applications. Previously, there were two applications for lab tests. The molecular pathology application was used to request CPT codes for Tier 1 and Tier 2 molecular pathology tests, genomic sequencing procedures, and MAAA tests. The standard pathology laboratory application was used for all other laboratory tests. The Molecular Pathology Advisory Group and the Pathology Coding Caucus reviewed multiple suggestions and rationales for the information they would need to accurately and efficiently review a CPT code change application for pathology or laboratory tests. They had multiple meetings to come up with this new application, which was then presented to the full CPT editorial panel for approval at its September 2019 meeting. Okay. So why were changes to the molecular pathology and standard pathology laboratory applications needed? The editorial panel needs essentially the same information for all pathology and laboratory procedures, but there were slight inconsistencies between the molecular pathology application and the standard pathology laboratory application. There is needed information that was not requested at all in the old applications. Some of the questions in the old applications were similar to the non-pathology laboratory Category 1, Category 3 CPT code application that are not relevant to pathology or laboratory tests. So they did not belong in the molecular pathology or standard pathology laboratory applications. Documentation requirements needed clarification and streamlining between the molecular pathology application and the standard pathology laboratory application. Some of the literature requirements for other procedures in the CPT code set are not relevant to pathology laboratory tests, and they needed to be fine-tuned to better fit pathology laboratory code requests. So what changes were made? Since the editorial panel's needs for considering code requests of molecular pathology and standard pathology lab tests are essentially the same, the two applications were merged into one pathology laboratory application. The inconsistencies in the questions and documentation requirements between the two applications were resolved. Questions that are not relevant to pathology or laboratory tests were removed. New questions for needed information were added. Documentation requirements were modified and clarified. Literature requirements were modified to fit pathology and laboratory tests. So now I'm going to transition and go into the Smart App tool. And here we are at the Smart App dashboard. And on the left side of the screen, you see a purple box, which has a drop-down field called Select Application Type. So I'm going to click on this drop-down field. And as you can see, there's only one possible selection for pathology laboratory code change application. I want to pause here for a moment to point out the proprietary laboratory analyses or PLA application selection here at the bottom. To submit a request for a PLA test, this is the application to select. However, the new merged pathology laboratory application is not to be used for PLA test requests. So I'm going to go ahead and select pathology laboratory. And I already put in a name, so I'm just going to select that and click Apply Now. So this pop-up screen is the first part of the application where there are changes. The first change on this screen is the note right up here in bold, which states that the test for which a CPT code is being requested in this code change application must be available for patient care at the time of application submission. This is not a new request, but is being explicitly stated in this first screen so that the applicant is aware that if the test is not available for patient care at the time of this application submission, it is not eligible for a CPT code. The documentation and literature requirements are clarified on this page as well. Items 1A and 1B clarify what documentation is needed specifically for FDA-approved or cleared tests and for non-FDA approved or cleared tests. So for FDA-approved or cleared tests, a copy of the manufacturer's product insert must be included, and a copy of the FDA Summary of Safety and Effectiveness Data, SSED in other words, should also be submitted. For non-FDA approved or cleared laboratory developed tests, otherwise known as LDTs, a copy of the standard operating procedure written in CLSI format or some similar format should be submitted, and it must come from a licensed, accredited, or certified clinical laboratory that currently employs the test. Previously, sample reports were requested in the molecular pathology application, but not in the standard pathology laboratory application. Sample reports are now required for all laboratory tests for which a CPT code or code change is being requested. This page also clarifies that sample reports of all possible outcomes of the test are required. Outcomes, of course, depend on the type of test. Examples of outcomes are positive, negative, or uncertain significance. If there are published guidelines on the usage of the test, they need to be submitted also. Examples are provided in the new application, and here they're listed. The National Comprehensive Cancer Network Clinical Guidelines, Gene Reviews Guidelines, or Medical Specialty Society Policy Statement. Regarding the literature requirements, for FDA-approved tests that served as a clinical trial assay, associated publications that relate to the test's clinical validity should be submitted. The number of peer-reviewed articles to be submitted has also been clarified to state that at least 3 and no more than 5 articles are to be submitted. The limit of 5 articles is to keep the volume of literature that the editorial panel must review to a manageable level. The new application also clarifies that at least one of the references submitted should address the disease association of the test, and that if the test method has not been previously associated with the analytes, then at least one reference should address the analytical performance characteristics of the test method relevant to the specific analytes tested in this code change application. And of course, you will be asked to upload the corresponding literature at the appropriate place within the code change application. So now I'm going to go into a code change application that I've already started. And we're going to go to the criteria. And there has been a change in the parameters specific for Category 1 requirements for molecular pathology, specifically for the duplication deletion assessment for code assignment. The old molecular pathology application stated that if the gene test database showed that equal to or greater than 10% of variants are associated with duplication deletion and equal to or greater than 2 duplication deletions are documented, then the duplication deletion test for the analyte would receive a Tier 2 code. Or if BioBase Human Genome Mutation Database Professional identifies equal to or greater than 10% of variants that are associated with duplication deletion, then the duplication deletion test for the analyte would receive a Tier 2 code. This guideline has been simplified, and the new application now states that equal to or greater than 10% of variants should have been associated with duplication deletion in a recognized database in order to receive a molecular pathology CPT code. And examples of databases are provided in the new application, which are Gene Reviews, BioBase HGMD Professional, and ClinVar. At the bottom of the screen, the new application now explicitly states that the minimum standard for administrative MAAA codes is that the analysis must be available for patient care. This means available at the time the application is submitted. This is not a new requirement for administrative MAAA tests, but it is explicitly stated in the new application. Okay. Now we'll go through the questions in the application that were changed, removed, or added. The first are questions that were removed, and this one had to do with FDA approval. The first question in both applications asked if the test has been FDA approved. As lab tests do not require FDA approval to receive a CPT code, this question has been excluded from the new merged application. So we'll go to the code placement, and this is the first section that has been modified. The section about code placement has been streamlined. The options are molecular pathology, GSP or other molecular multi-analyte assay, Category 1 MAAA, other pathology laboratory, administrative MAAA, or Category 3. Now, if you're requesting a code for other pathology laboratory, then the specific subsection needs to be indicated. For example, is this a test that goes in the chemistry section or in the microbiology section? So if you click on the box for other pathology laboratory, then a text box will appear, and you just enter in the name of the subsection where you want the new code the new code to be placed. Okay. The next question that has some modifications is the test performed annually question. In the test performed annually question, there was an inconsistency in the old applications in that the molecular pathology application provided less than 50 tests as the first option to select. And the standard pathology laboratory application started at less than 49 tests. This inconsistency has been resolved in the new application, which provides less than 50 tests as the first option. And as you can see in the drop-down, the first selection to answer this question is less than 50 tests. And a similar clarification has been made in the tests performed in laboratories. The ranges were inconsistent between the two code change applications, and this inconsistency has been resolved. So the drop-down, the first selection of tests performed in labs is less than 5. In addition, the old molecular pathology code change application had a second part to this question, which was, do you anticipate this number to change in the near future, and if so, how? This second part of the question now applies also to standard pathology laboratory tests, so it must be answered regardless of which type of test you are requesting a code for. That question is right here. Okay. A parenthetical note has been added to this question, which states that anticipated volume, and I'll highlight it here for you, anticipated volume increase in itself is an insufficient reason to support issuance of a new CPT code. However, sound evolving clinical practices will be considered by the CPT editorial panel. This question regarding distinct service was on the old molecular pathology application, but it was not included in the old standard pathology laboratory application. Now this question is included in the merged new application and is required for all lab tests. The next question, present codes inadequate. This question was in both of the old applications and asks why present codes that already exist in the CPT code set are not adequate to describe the test, and if a test represents a variation in a testing methodology or a new analyte employing existing methodology, do the existing codes describe the test but not to the same level of specificity? However, there was an additional part to this question in the old molecular pathology application, which asked how specificity created by this new code would improve reporting and test identification. And that question has been added to the new application and is applicable to all types of pathology laboratory tests. Okay. The major code differences question has been modified. The old applications asked for the major differences between the proposed code and any other related codes already in the code set. The molecular pathology application had a second part to this question, which was, when the procedure described in the proposed code is similar to that of an existing code, please give a detailed explanation of the differences. For example, testing methodologies or associated diseases. This second question was included in the new merged application and should be answered for all types of pathology laboratory tests. The next question that has been modified is the performance or quality measure by any national organization question. And this question actually has not been modified, but was not included in the old standard pathology laboratory application. It was only in the molecular pathology application. So it has been included in the new merged application and is applicable to all tests. A new question has been added, and this question is regarding analyte biomarker disease association. And it asks, has the analyte biomarker disease association been established? And if so, please provide up to 3 relevant citations. And an area here is provided to upload those files. The years of procedure being performed question has been modified. The drop-down box provided responses of half-year intervals, for example, 1.5 years, 2.5 years, etc. And this was modified in the new application so that only whole numbers are provided as options to select. For example, less than a year, 1 year, 2 years, etc. The Clinical Laboratory Improvement Amendment question has also been modified. This was in both of the old applications, but in the old applications, the question asked if the test is classified under CLIA. In the new application, the question has been revised to ask how the test is classified under CLIA, meaning either high complexity, moderate complexity, or CLIA waived. And the options of don't know and not applicable were omitted as possible responses to this question in the new application. The practice parameters in the old applications are now referred to as practice guidelines in the new application. The old applications asked if the applicant was aware of any practice guidelines or policy statements regarding the use of this test to diagnose or manage patients with specific diseases and to provide copies. This question has been modified in the new merged application to align with the clarified documentation requirement and simply asks if the applicant is aware of any published guidelines regarding clinical usage of the test. Examples are given of the type of guidelines the panel is looking for, which are listed here. The National Comprehensive Cancer Network, NCCN clinical guidelines, gene reviews, or medical specialty society policy statements. And there is an area here to upload the related documents. Some modifications were made to the proprietary test information, and these questions are strictly related to Category 1 and Administrative MAAA tests. So these are the only tests for which these questions need to be answered. The old molecular pathology application asked if the applicant represents a lab that performs the test and asked for the laboratory name, street address, and email address. A second part has been added to this question in the new application that asks the applicant to identify any other stakeholders who have an interest in this test. Now, if the applicant does not represent the lab that performs the test, the old molecular pathology application asked if the applicant was in contact with the lab that performs the test and to indicate if the lab is in agreement with the code proposal. In the new application, further specificity has been added to this question, and it now asks, have you contacted the relative stakeholders, i.e. performing laboratories and test proprietor of the procedure represented in this proposal? And again, the answer is only required if requesting a Category 1 or Administrative MAAA. So this question was specified to indicate performing laboratories and test proprietors as the relevant stakeholders. And the site of service question was slightly modified. whereas the selection for hospital inpatient laboratory has just been changed to hospital laboratory. So it is not specific to hospital inpatient laboratory. The typical patient description has been modified with instructions here to not exceed 75 words. So there's just been a parameter placed on the length of the clinical vignette or typical patient description. Okay, and now we'll go back to the supporting documentation, which we addressed at the beginning of the walkthrough. These are the actual questions that ask for that documentation. So copy of manufacturer's product insert has been updated to clarify that this piece of documentation is only required for applications for FDA approved or cleared tests, and it provides, of course, an area to upload the manufacturer's product insert. The FDA summary of safety and effectiveness, again, this was not a document that was previously requested in the old applications, but is now being requested in the new application. And it clarifies that this step is only required for FDA approved or cleared tests. And you would upload the document here. The standard operating procedure also clarifies that this document is only required for applications for laboratory developed tests that are not FDA approved. And I want to back up that this also has some additional instructions added for the SOP. The SOP must include sufficient technical data to support development of an appropriate CPT code descriptor for the test. A new question has been added for intended use, principle, and limitation. Now, these three elements are elements that should be included in either the manufacturer's product insert or in the standard operating procedures document. However, if these elements are not included in either of those documents, then the descriptions need to be provided here. So the question is here, or I'm sorry, it's really instructions rather than a question. If not addressed in the SOP or product insert submitted for this test, please answer the following question. If the requested information is addressed, then please enter addressed in SOP or addressed in product insert as appropriate. And there are three separate text boxes provided to describe the different elements. So the first text box is for the intended use of the test. The second box is for the principle behind the test. And the third box is for any test limitations. Okay, and then sample reports. We have also already covered sample reports, and the reports are uploaded here. And as a reminder, reports of all possible outcomes should be submitted. So sample reports should be submitted, whether positive, negative, or any other type of outcome. And they should be submitted for all pathology laboratory tests, and this does include administrative and AAA tests as well. A new question has been added regarding U.S. versus foreign population. And this question is getting at If a study is performed on a foreign population in a different country, do the results of that study apply to populations in the U.S.? And it asks for documentation that substantiates that. So the question specifically says, was the study submitted with your application performed on foreign populations? If yes, are the results of the studies applicable to populations in the U.S. population? If yes, please provide documentation to substantiate that the results of the studies are relevant to the U.S. population, and you would upload your documents here. Okay, and then finally, we're going to go into the reference citations. The reference citation section has been modified to ensure that useful information is provided for pathology laboratory tests. Much of this section was already in the old standard pathology laboratory application, but not in the old molecular pathology application. So I am going to go into a little more detail here. So this first paragraph just explains the literature requirements, and then the next paragraph lists what should be included. So it says here, please provide electronic, PDF, or Word document copies and internet addresses, if available, of literature to support your application. And this first item asks to provide a concise, relevant statement, and there's a place for this statement to be included further in the application. And there needs to be a relevant statement provided for each reference that's submitted to support the application. Number 2, and we've already covered this, states that if the test is FDA approved and served as a clinical trial assay, then any associated publications that attest to the test's clinical validity and utility should be included with the application. And again, at least 3 and no more than 5 peer-reviewed articles related to the test analyte's clinical validity and utility should be submitted. At least 1 reference should address the disease association to the test, and the references should not be references that simply describe the underlying disease or diagnostic condition for which the test is ordered. Different authors are preferred, and this means no overlapping authors with the same patient population among the articles submitted. Okay, as you scroll down here, there's a link called General Guidelines for Article Inclusion and Literature Requirements. So when you click on this, you see a PDF document comes up. It reiterates the literature requirements that we just went over, and it also includes a level of evidence table. The level of evidence is what each reference demonstrates. So what level of evidence is demonstrated in each of the references that you submit to support your code change application. So there is a level in this first column, and then the level is defined in this short description in the second column. So when we go back to the Smart App and we begin to enter the information regarding the references and upload the references that support the application, the first question asks, which code is the citation supporting? And this question is here because oftentimes more than one code is being requested, and this helps the panel identify which code the reference is relating to. So the codes that you've entered will automatically appear here, and you just select which one. There's only one in this application, so we'll just select it. This next field is where you're going to place the publication title, the author's names, and the year that the publication was published. The next section is where you will upload the particular reference, and next is where you will provide the level of evidence that is demonstrated in this particular reference. So here are the different levels, and this is where you want to go back to the PDF document and review the different levels so you can identify the level that best describes the level that's demonstrated in the reference that you're referring to here. The next question asks for the society or organization with the editorial responsibility for the publication. The next question asks for the total number of patients studied. And then here, this is where you will put your relevance statement. So how is, and it says right here, for each article cited, please provide a description of why the specific literature reference is relevant to the code change application. For example, this is the Hallmark double-blinded controlled study establishing the value of the procedure or service. Or this is a case report describing the procedure or service in detail. Or this is an opinion statement from a respected authority in the field. Then what you would do is save, and it would also give you an option if I had actually completed these fields. You would have an option here to upload another reference, and then you would answer all of these questions again for each of the references that you upload. When you download the code change application and have the Word version of the application, this is the information that was entered and how it will be displayed in the application. So it lists right here, this citation is in support of which codes, and the codes that you checked will be displayed here. And then the name of the publication, the author, and the publication date will appear. The level of evidence will appear. The society or organization with editorial responsibility for the publication will appear in this field. The number of patient studies appear in this field, and then here in this space is where your relevance statement will appear. The name of the document that you attach will finally be listed, and this will be displayed for each reference that you provide this information for. So this actually concludes our walkthrough of the new Pathology Laboratory CPT code change application. Now we've provided some contact information here for any questions or feedback that you have on completing the SMART app. We have an email address, which is ccappsubmit@ama-assn.org, and a toll-free number, 888-291-6460. Thank you for your interest in the CPT code set, and we look forward to any questions or feedback that you have.